Well, that's a nice segue into our next reader question, which talks about Tamiflu and Relenza. She says that those of us who did opt to stockpile Tamiflu and Relenza for our employees are now coming close to the stockpile's expiration dates. So she wants to know, do you think we should be replacing these stockpiles at all? And is Tamiflu still the recommended antiviral option?
I think it does depend on the actual the patient's condition, and it does depend on the flu. Generally speaking, Tamiflu and Relenza are just one piece of defense in depth, but they're probably not likely to have a great return on investment, whereas hand washing and limiting people being exposed to the flu and encouraging people to stay home when they're sick, I think is a much better, much cheaper way to limit the spread of illness within a business environment.
And I'm just going to go ahead with my my canned answer, which replicates a lot of what Scott has said. There's other ways to prevent the spread of flu: work from home, staggered work hours, more web meetings. If a business wants to buy that stuff, great. But actually, proper hygiene with your employees and keeping them home when they're sick is going to work very well.
Keep in mind, Tamiflu and Relenza don't stop you from getting sick. For the most part, they make the course of illness less severe. So there are times when it works better than others, but neither one of them is a panacea.
Right, and they have to be taken at specific times in the illness also, which makes it problematic if you don't have a healthcare provider to tell you that.
Okay, we had a reader bring up a specific situation. I don't know if you have any insight onto this. She mentioned that her organization had difficulties providing medications, namely Tamiflu, to their employees based in India. Do you know anything about that issue, why it was an issue, and if anything's been done to solve this problem?
Maybe Dan knows. All I know that Tamiflu is has a generic version in India, so I'm not sure why there would be a problem getting it to your Indian employees.
And Luke, I hate to do this to you, but I'm going to read the answer I sent you.
Sure.
Verbatim. I have no clue.
Okay.
There's going to be there's a generic version launching since 2006. There's been a generic version there. I'm not sure what the current problems are.
Okay.
Yeah, but it's up to the company. I mean, if the company can mail the stuff from the States if they're really concerned. But again, we've already explained Scott's done it in depth, the how and why of Tamiflu. And so it's better if they just do those sanitary procedures and processes and protocols and avoid getting ill if they can.
We're just about out of time, but I wanted to ask one more question. I guess it relates to the supply chain for vaccines and medications. I think the media again does hype up shortages and whether we have enough vaccines and medications for everyone. What do you think our readers need to know about the supply chain and the availability of these vaccines? And do you think there will be a shortage?
There's two different issues here. One is specifically for flu vaccine, and the second issue is for drugs in general. There's actually a huge problem right now in the United States with drug shortages. The American Society of Hospital Pharmacists has a whole drug shortages resource center, and there are literally hundreds of drugs, lots of emergency drugs that are actually on this list where they're just not being produced in numbers, either because of shortages in raw materials or problems with quality control or a variety of different issues. So in America, the problem of drug shortages is getting, I'm not going to say really bad, I'm going to say that the problem of drug shortages in the U.S. is becoming a real public health crisis. Because we have a limited number of pharmaceutical suppliers, and because of the liability issues and quality of raw materials and quality of production, we're going to be facing a more and more shortages of medications in general. Now, specifically on flu vaccine is because of the way it's produced actually by using live eggs still. We don't have a a non-egg-produced vaccine yet in the United States. It's completely dependent on consumer demand. And so was it 2 years ago, when demand was really high, we actually didn't have enough early in the season. And then we had too much later in the season. Generally speaking, we have more than enough flu vaccine. Now, there's a number of different, there's two different ways to administer flu vaccine. There's a nasal vaccine and there's a shot. It depends on your age bracket and a number of other personal factors about which is right for you. But there's almost always a vaccine available. And if you get people who are willing to take it, it's going to prevent illness. But the truth is that I think drug shortages are going to become more and more of a problem over time.
And there's protocols in place federally. We saw that during H1N1, where they're going to categorize people into groups that should get these medications, vaccines, whatever they're going to be, as they come out by priority. And that will, again, depend on whatever the disease process is. Some diseases will affect the elderly, some will affect the young. And so if disease A affects the elderly, they're going to insist the elderly get the medications first, usually after healthcare providers and whatnot, who will also be on that first priority list. But Scott's right in everything he said.
I also don't, Dan, you know my feelings on this, I also don't have a great deal of faith in the government to do things super efficiently, and to not do things that are... Government is inherently political, so they don't always do the exact right thing. They do the right thing that fits into their political context.
I don't have a problem with that. Being a local government, low-level functionary in a county, I'll say that we do our best, but we have no control over medications. So I know Scott is specifically speaking at a higher level.
Okay, well, is there anything else that we haven't covered so far that you'd like to mention in relation to pandemic preparedness?
There is, Luke. I was just reading this morning one of these big, clunky theoretical research books, and I was reading the section specifically on business preparedness, and unfortunately, the research we have shows that businesses that prepare are really no better off after disasters than organizations that don't, mostly because the things that affect businesses are based on external factors. And so, for example, in the pandemic flu, your organization might spend a lot of money and effort to prepare, but you're going to be limited by how the government responds, how vaccines are available, and so on. So perhaps rather than spending a lot of time focusing on developing a specific pandemic plan, one of the things that was shown to actually be a significant factor in business survivability was how your business can be highly adaptable to changing market conditions. Because it was shown that organizations that were more adaptable to the market and to demands were more likely to survive in the long term. If you're a humongous business and you have multiple product lines, that's great. You're well diversified. If you're a smaller business or you work in one particular segment of a market or a geographic area, then that adaptability is probably a little different than what you do every day, and that's actually the kind of things you need to be thinking about.
Thanks, Scott. Dan, you get the last word if you want it. Hey, I will just concur with what Scott just said. The Florida motto, the Florida Emergency Management motto when Craig Fugate was here, and probably still is today, is be flexible. And they would always show a little Gumby figure during PowerPoint. So what he said is exactly right. Okay, for those looking for more information, this podcast is accompanied by links to relevant pandemic preparedness-related resources. Information about our upcoming podcasts is available on the Continuity Insights LinkedIn group or via our weekly CI Bulletin e-newsletter, which you can subscribe to at continuityinsights.com/subscribe. Dan and Scott, thanks very much for speaking with me today.
Thank you, Luke.